Christine, thank you. We do have a panel, Stephanie and Dr. Anna Pett, who's from the Department of Health. Anna, welcome. And Anna, while you're coming up, you get the first question. But could what has happened in America with regard to public health, ever conceivably occur in Australia? Are there, and if it couldn't happen, what are the safeguards?
Well, I think for any of you watching Senate estimates this week, we faced a whole barrage of questions about the US situation and their diminishing support for vaccines. But what I was able to confidently say was how much we support vaccination in Australia. And very importantly, many of the politicians stood in and actually spoke positively about the value of vaccines and the National Immunisation Program more specifically. One thing I would say though is it was very pressing upon me the importance that we all have in this room to be able to speak positively about vaccines. And Christine's presentation just on lives saved, severe disease prevented, it's amazing how much that has impact and the importance of us constantly repeating it and being able to stand up against it. I do think some of the other comments David's spoken about, our want at a government level to be a bit more nimble in how we communicate, but also constantly have that background noise talking about the value of vaccines. But I think it's upon us all to continue talking positively, but I'm an optimist like Christine. We're very lucky to live in Australia and have broad support for vaccines from government.
It's very reassuring. Stephanie, I'm assuming you've got a 25-year contract with the CDC?
Not at this stage.
So, does it look as though it's going to be in Australia forever? From your viewpoint, has it started with a strong foundation?
I think in establishing a national public health capability in Australia built off decades of investment and partnership, of which part of it is the National CDC, which is a few months old, but built on decades of investment, not just in what government is doing in public health, but what people in this room, through the National Centre, through other partnerships have been doing. What the legislative basis to create the CDC does is establish the institution and gives it the best possible platform to start a good journey in public health. But it would be short-sighted to guarantee anything into the future other than it's got the best possible start, I think, at this time, in 2026.
Question to Stephanie regarding the relationship between TGA and CDC in the selection of vaccines.
I think the question, Lou, you're referring to is the AIVC, the Australian Influenza Vaccine Committee, which is administered by the TGA. And we are in discussions. The TGA is part of the department, and we will work closely with them, as we will continue with the department. And we are just talking with our colleagues about whether the core function of that committee, in the looking at the epidemiology of influenza in the region, in Australia and globally, would be could be administered by the CDC or continue with the TGA. So it's an open discussion, but certainly when it comes back to the core functions and the role of bringing experts together in a committee to inform vaccine strain selection, that's in active dialogue.
Thank you. There's another online question. With measles vaccination, there are recommendations for those who receive early measles vaccine regime for those older adults, and there may be recommendations for, yes, it relates to natural immunity.
I think we're going to hear more on measles this afternoon, but I would say, and I'm just trying to remember whether this preprint is up yet, but it relates to a project, a piece of work we've done at NCS. There's around 1.7 million Australians estimated to be non-immune to measles. That's a very crude number. It's been based on data that we have from when past infection occurred, when vaccination started, the transition over time, and that's, counting 2-dose vaccination as being protective. We know that people who are 60 and above, woohoo, not above, just telling you there, are likely immune to measles. I remember having measles. Can I say, Lou, my mother, who was a nurse, kept me at home. She said, "You nearly died, so I nearly took you to the hospital." But the most important thing is that some of us have had measles, some of us have had 1 dose of vaccine, some of us have had no dose of vaccine, some of us have had, delayed in getting our vaccines. And when we went from 2 doses of 1 dose to 2 dose, we missed a lot of adults. We had a campaign around 2000 that missed a lot of adults. So there are adults who are probably not immune to vaccine. You can have, measles extremely rarely if you've had 2 doses. But what we could do, there's about 5 things that we could do to understand our measles immunity better. One is something we've done in Australia very well over many decades, which is a national serosurvey looking carefully at where immunity lies. So I think it is very hard for an individual adult now, if they don't know their history particularly well. We only had an adult immunisation register from 2016 to know about their measles immunity. We've got a flowchart on the NCS website. If in doubt, just get a measles vaccine, and it's actually through the patchwork of NIP funding up to 20 and state and territory funding now free for anyone to get a measles vaccine. I've had actually 4 as well as having measles, and I'll tell you that story another time.
Thank you. And how do you harness that type of energy? Because policymakers see medical practitioners who advocate, and then they become completely emotionally overwrought. Do you fall back on the science, or do you get wrapped up in the wave of enthusiasm?
Look, I must say we're ever increasingly leaning on the likes of Christine to speak on our behalf. And I think there's probably there's the science that you'll no doubt know about far more deeply, but I know that what gets a lot of traction with our government and also community members is being able to say the stories of people on the ground, individuals, and just making sure that as many people are hearing about what happens when people don't get vaccinated or don't get access to vaccines.
Are there any questions from the floor? Yes.
Hi, Nigel McMillan from Griffith. Thanks everyone for this first session and the uplifting, positive message that we got about our problems. One of the things you said I thought that was really interesting was that the degradation of trust in institutions is a really quick way to destroy trust in the actual science itself. And I know in my own social media, I get this a lot, and it's, the WHO is a cabal that's out there, and the doctors are all in the pay of big pharma. And so I guess the issue is, how do we really address that? Obviously, clear political leadership and support is important, but how does that look going forward? How do we counter the distrust in institutions, which really shakes the foundation, rather than obviously people going to talk to their healthcare? Because I have social media interactions with young men who will not go to their GP because they do not trust them. So because of these sorts of things. So how do we deal with that going forward? Anyone?
Look, I'll have a stab first, and I think what we absolutely know is I think we have to activate what we do at every single level of society. And so I think, David, you spoke about that as well with the NIST, but giving people information that is meaningful to them, that they can use at a community level. So if it's someone in a local small community, it's a GP, it's someone, the pharmacist, it's someone that's sort of got some level of trust perhaps in that community. It's the mayor, it's the, you know, the community advocate. They can easily access information that allows them to, you know, go out and have a little conversation about immunisation and say, actually, I've found this out. I've got this information. I think you can trust what you're hearing from this source or this source or this source. It's a very complex space, public health. I mean, there's so many institutions and so many people, and all of them can be sort of, you know, you'll find something negative about absolutely everything in the world. Kittens, there's probably negative stuff about kittens out there, or negative stuff about anything you want on social media. But I think it's taking the time and having people at every single level able to have that sort of information that they can relay and take the time with people. I mean, it is time consuming, but I think it's critically important that we have all of that. And we have to listen. That's the other thing. I mean, communication isn't one way. I think that was on my slide. We have to engage and understand how to message, how to, how we can get traction in this very complex world through all the channels that we can utilise. Anna or Steph?
Yeah. Look, I guess from a public institution type perspective, I think it's really important for us to be able to describe why we've made the decisions that we've made, especially in the vaccine space, and really repeating those messages about evidence, based on evidence, and this is what we do. But I think going to Christine's point, the idea of sitting with people, listening and being willing to answer their questions in a way that they can understand. And I think at times maybe public institutions may not have been as effective as they could be, but I know when we're looking at our whole of life immunisation campaign approach, we are really trying to look at the different ways that we communicate and get those messages across to where they're listening. So use of social media, God help us, TikTok, maybe one day. So really, really trying to be there to speak to people and also to be able to speak in a way that they understand.
And
Now, thanks. Steph, last word.
just to add really briefly, I think it's one of the opportunities that the CDC brings with it is an opportunity to be more nimble in the way we communicate, especially on public health challenges. And I know some of the work that Julie Leask has done about mis and disinformation, the energy investing in chasing mis and disinformation could be better invested upfront in the pre-bunking of the myths, as an example. But just the second piece, just to pick up on what Anna said, one of the expectations and legislative provisions around the CDC is the expectation that should advice be published, the evidence underpinning and the explanation of why is published with it. It's two small examples of how, in 2026, there are some opportunities in the current landscape that the CDC is offering to address some of these.
Stephanie, thank you. A great note to finish on. I'd like to thank the panel for their expertise and their enthusiasm.